Are glomerulations linked to bladder pain syndrome? Imagine going to the doctor for bladder issues and hearing about tiny spots of bleeding in your bladder lining. These are called glomerulations, and they've long been thought to be a sign of bladder pain syndrome, also known as interstitial cystitis. But recent research shows that glomerulations are not a reliable or specific marker for this condition. Glomerulations are small pinpoint areas of bleeding or mucosal hemorrhages that can appear in the bladder lining after a procedure called bladder hydrodistension. While they have been used in the past as a diagnostic clue, studies now show that they are found not only in people with bladder pain syndrome but also in people without any bladder symptoms. This means that their presence alone doesn't necessarily mean someone has bladder pain syndrome. In fact, glomerulations can appear in healthy bladders and may change over time. They are also seen in other bladder conditions, which makes them less specific. Researchers have found that glomerulations do not consistently match the severity of symptoms or the clinical diagnosis of bladder pain syndrome. For example, some people with severe symptoms may not have glomerulations, while others with mild or no symptoms might have them. Bladder pain syndrome has different subtypes. One involves Hunner lesions, which are distinct inflammatory spots on the bladder, while that are more clearly linked to bladder pathology. These lesions tend to respond better to treatments targeting the bladder itself. However, glomerulations are more common in the non-Hunner type of bladder pain syndrome, but their presence alone is not enough to diagnose or classify the condition. Because of these findings, medical guidelines now recommend that glomerulations should not be used as a definitive diagnostic marker for bladder pain syndrome. Instead, diagnosis should be based on a combination of symptoms, ruling out other conditions, and looking for Hunner lesions when present. The key point is that glomerulations are not specific or reliable indicators of bladder pain syndrome, and their significance should be interpreted carefully within the broader clinical picture. In summary, while glomerulations can be observed during certain bladder examinations, they are not a clear sign of bladder pain syndrome. It's important to work closely with a healthcare professional to understand your symptoms and get an accurate diagnosis. Remember, each person's bladder health is unique, and treatment should always be tailored to individual needs. Always consult a medical expert for personalized advice and proper evaluation.